On passe à la communication suivante avec Monsieur Wali d'Alexandrie.
Good morning, everyone. So it's a pleasure here to be among with you in this day, second day of Incontinence. I've been invited by Professor Mustafa Al-Mashri, and it's a pleasure to be among all of you. Today, I will give a brief on the prevalence of urinary incontinence in Egypt and Middle East. I know it's all in French, but it is not my native language. I mean, not my second, the second is the English, so I will go through English, not in French. And to go through this, we should know about history, how it started in Egypt. And actually, it doesn't differ from all other countries, which at least from Tunisia, which I lately heard from my dear colleague, that the data is sparse. It's very few papers. And this was the first one in 2007, talking about the prevalence and risk factors. And this was assessed in a city in Egypt, Asyut. It was a cross-sectional based study, and there was about 1,652 females were included. The age was 20 years or more. And these patients, they completed a questionnaire, the Urogenital Distress Inventory 6 questionnaire, to look for the prevalence of urinary incontinence. And how this was done, specifically, there was a research nurse. She visited some selected regions, and she went to the patients in their houses, and she completed with them this questionnaire face-to-face interview. So to know that, because if you give the patient a questionnaire or a poster questionnaire, or even on the internet, it wouldn't be that much easier if you go and do it like interviewing the patients face-to-face. Because she went and knocked every door, the response rate was quite high. As you can see, about 97%, only 56%, about 33%, they rejected to do this interview. And the prevalence was quite high, maybe the same as we saw in other countries. About 55% of the patients had. The risk factors, which were higher age, low educational level, the menopause, higher parity more than 3, of course, vaginal deliveries, and previous multiple abortions, these were significantly associated with urinary incontinence. And the prevalence of urgency incontinence was 15%, the same as stress incontinence, but the most common was the mixed type. About a quarter of the patients, about 25%, had mixed urinary incontinence. What about the severe incontinence? The severe incontinence, that's to say heavy incontinence, was about 9%. And the strongest factor associated with this severe incontinence were the multiparity, menopause, and reported abortions. This is very important, the quality of life. Let's see what made the patients really distressed or they wanted to go and seek medical advice. Number one was inability to pray. So there were prayer issues, about 90%. Number two was the low self-esteem, because the patients were feeling being unclean from all the time they are wet by the urine, about 65%. Difficulty in performing any physical activities, like in the housewife activities, like about 1/3 of the patients. Limitation of social activities, if she wants to go outside, want to visit some friends, whatever, they will be wet, about 30%, and coital incontinence, that's to say urinary leakage during intercourse. This was very astonishing that only 4% of all of these patients sought medical advice. So the access to the medical service, it is not the matter of the access to the medical service, but it is the access that the patients, they did not go to the medical service. 3 years later, the same group, they wanted to look for the barriers, why these patients did not go and seek medical advice. So again, they give the same questionnaire, and they had 1,231 patients. Look, about 348 had urinary incontinence. And again, about 80% of them still did never sought medical advice. What was very astonishing that the educational level, as we might think, could be the factor which lead us to go to the doctors, it had no significant promoting factor, not relate that the patients will go to the doctors, the education level either of the female, the patient, or her husband. However, which was promoting factor was the husband encouragement, because maybe he was distressed by this as well, prayer, affection, presence of coital incontinence, and if the incontinence was severe. But what about the barriers against the consultation? Why I'm not going to the consultation? Number one was embarrassment. Embarrassed to tell that she has such a problem, and it's about 70% of patients. Number two, and we see it a lot, to assume that is a normal part of the aging process or after multiple births. And of course, these patients, they speak with each other and they say, yes, it's very normal, so we will not go to the doctor. It's inevitable and happens. Choice of self-treatment. She tries to self-treat herself. The low expectations from medical care. She says that I will not gain anything if I want to take the consultation and take any kind of medications. She thinks maybe the urinary incontinence may resolve by itself. It could be self-limited. Or she may think that it is costly. It may have much higher burden or higher expenses if she wants to do that. 13% of these patients, they thought that this complaint were taken seriously by the doctor. So those who went to take the medical advice, only 13%, they think that their complaints were taken seriously. About 90% of them, they said that the physicians were not taking it considerably. They were reluctant to give them any further management. And as you can see, for those who were given treatment, about 37% the condition improved, 54% it was the same, and 8% said their condition was worsened. This is another paper from another city looking for the incidence of nocturnal enuresis in females and its relation to urinary incontinence. That included 350 females from Ismailia government. This is another city in Egypt. And it included patients, female patients 18 years or more. They had 4 trained nurses. They interviewed the women also at their houses. As you can see, it's very important in this paper to see that these patients were attacked at their houses. They went to their houses and they were asked there. And they were given this international consultation of incontinence questionnaire in the Arabic validated form. And they assessed the incontinence and the presence of nocturnal enuresis. As you can see, the age was 18 years or more. So this is an adult nocturnal enuresis. It was present in 3%, 12 out of 350. There was statistically significant association between the presence of nocturnal enuresis and urinary incontinence as a whole. Why? Because we had 11 out of these 12 patients had urinary incontinence, most of them with mixed type. This is a very important study. We know the EPIC study. The EPIC study, it evaluates the LUTs. It is a very large study. This study was also done in Egypt. So the other EPIC surveys, as you can see, were conducted in all these cities, in all these countries: Canada, UK, Germany, Sweden, Italy in 2005, Korea in 2006, China, Taiwan, Hong Kong in 2008, and the Czech Republic, Russia, and Turkey in 2010. In all these studies, the prevalence of lower urinary tract symptoms was about from 54 to 83% in males and from 67 to 87% in females. The aim in our study was to estimate the prevalence of these LUTs in Egypt and the impact on the quality of life. So this was population-based cross-sectional survey as well. The screening was first performed over the phone. Here it is another issue. They did not go to the patients themselves. They would have a screening randomly selection over the phone to just have agreement that they want to participate in the survey. And if they accepted, then the interview were conducted also face-to-face. The participants were questioned if they have any kind of LUTs or overactive bladder symptoms. And the target was about 3,600 patients from 4 main cities in Egypt. We had a total of 600 participants were considered for follow-up. And this follow-up, we had 300 patients with the urinary incontinence and 300 as control did not have any urinary incontinence. 86% of our patients from the 3,600 at least experienced one symptom of lower urinary tract symptom. And the storage symptoms were more frequently reported. The most prevalent symptom was nocturia. So nocturia was present in about 70% of the patients. And this urinary incontinence was reported by about 20% of the patients as well. Again, if you see the access to the medical service, few individuals took prescription medicine, only 12%, or even they consulted a healthcare professional, about 25% of these patients. This was followed by a study in Cairo. to look in the incidence of urinary incontinence in the elderly female patients. It was done on 130 female patients, 60 years older, and each patient was giving history and physical examination, and also they were assessed by the same questionnaire, the ICIQ, the short form, and the IIQ-7 short form. The prevalence was quite higher, as you can see. It's 80%, not like the other 56 or 50%. And the mixed type was the most prevalent in the frail elderly females. And all the subscales of the International Incontinence Questionnaire were higher for women with mixed urinary incontinence. This is another study. This is very, very late in 2021, and this is evaluation of the prevalence of overactive bladder symptoms in females from Algeria, Egypt, Jordan, and Lebanon. And the aim was to estimate the prevalence of the symptoms of overactive bladder in females living in the Middle East. This is a cross-sectional study, as I said, in these 4 countries, in females over age of 40. The respondents were recruited using telephone-based, computer-based telephone interview over 4 months. And then they were asked if they were eligible to enter the study to complete the overactive bladder symptom questionnaire. We had a total of 32,261 females from, as you can see, from Egypt. The number was about nearly 6,000 females. And if you look for the numbers, I will not go through the others. Maybe I will look for the Egypt. It's about 10% of the patient, they agree to participate in the interview. Actually, when we see it's over the phone, not it's like when you do the interview face-to-face. The response rate, as when other studies, was about 90%. Here it decreased to 10%. Even if you look for other countries, for Algeria, for example, the response rate is 12%. Egypt, it's 10%. In Jordan, it is 8.7%, and in Lebanon, it is only 3.7%. The overall, about 54 of these patients had symptoms of overactive bladder. In Egypt, the incidence was about 57.5, and overall, 90% reporting also symptoms of urinary incontinence as well. How many of these patients were receiving treatment? Only 13%. So again, this is a matter of access to the medical service and the patient's willingness to go and seek the medical advice. Among those who are not treated, about half of them, they said that they are not bothered by their symptoms. About only 8%, they considered overactive bladder to be part of their normal aging life, and that's how they are coping with it. This is the last thing in Egypt. In 2020, in the late 2020, we started trying to make our Egyptian urological guidelines. And actually, we had this Egyptian urological guidelines, which is present now. It was launched in 2021, last year. We had 14 committees for 14 chapters. This is the chapter with the female urology. These are the board members. And now we are talking about how to treat the urinary incontinence according to the Egyptian culture and according to the papers, in accordance with the guidelines from other international publications as well. So to conclude, the urinary incontinence is an underdiagnosed problem, an underreported one. The prevalence in Egypt and even in the Middle East still remains underreported. We don't have, despite these figures which I've shown you, but this is an underreported problem. Very few seek medical advice, and even a minority of them, they receive medical treatment. And it's very important to know that most affected women with urinary incontinence in the Middle East, they have different quality of life concerns other than other countries, including, number one, the disruption of their prayer schedule and interference with the sexual activity. Women in the Middle East countries may have different and more complex barriers than their counterparts from other cultures as well. Thank you.